When you hear the words mass fatality, you may automatically think of the terrorist attacks of 9/11 or the natural disaster of Hurricane Katrina, incidents that experienced high numbers of fatalities. Rural communities can be faced with mass fatality events with far fewer victims. By definition, a mass fatality is an event producing a number of deaths that exceeds the capacity or capability of local authorities to handle, thereby requiring assistance from outside the local jurisdiction. To help rural communities become better prepared to handle a mass fatalities incident, the RDPC is offering AWR 232, Mass Fatalities Planning and Response for Rural Communities. This 8-hour course, certified by the U.S. Department of Homeland Security, is offered free of charge to qualifying rural jurisdictions.
AWR 232, Mass Fatality Planning and Response for Rural Communities, is a course really designed for anyone from a rural community, and that can be from your local officials to first responders, law enforcement, funeral directors, emergency management personnel, hospital personnel, pretty much anybody in the rural community, the local community that may find themselves as a part of the mass fatality response.
A community's response to mass fatalities caused by a disaster can be difficult to handle if the community does not have a clear plan as to the roles and responsibilities of those responding to the incident.
Key points of the AWR 232 would be how that the responsibility for managing the mass fatality lies with the local officials, and then the different aspects of the response, three major operational components being the recovery operations, the morgue operations, and the family assistance center operations, and how that they're all interrelated and how that we cannot really emphasize one more so than the other, but how that all three are very important.
The reason why we wanted the AWR 232 class here was to help us as far as in our mass fatality planning, because that is one of the focuses for our grant year, and with that we wanted to be able to bring our partners together and be able to learn a little bit more about it and what our involvement might be. As a health department, that's something we're just not used to.
Unlike large metropolitan cities, rural communities may often find that the lack of local infrastructure and assets make it difficult to respond adequately to a mass fatality incident. Assistance from outside the local jurisdiction is then required.
We discuss who the different stakeholders are, both on the local level, state level, and on the federal level. How federal resources are coordinated and are brought into the local level when that is done, and what they can expect.
AWR 232 participants learn the significant differences in establishing and managing a response to a mass fatality incident as compared to the daily routine coroner and medical examiner operations.
Mass fatality response is a whole nother operation. It really takes you out of your day-to-day methods and the way you do things, and it brings you to a whole new level. That's why this course is so important, so that we can talk about and discuss these different operational areas and areas of responsibilities, and so that the local authorities, local officials, and responders can be adequately prepared to deal with such an emergency.
It is also important for local non-governmental organizations to learn how they can partner in mass fatality incidents.
The benefits of taking AWR 232 would be to, if you're involved in that regional preparedness team, you would have a more in-depth, complete plan versus trying to adapt at the time of the event. Having a plan is going to make all the difference.
You know, larger cities who have robust coroners offices and ME offices and many police officers and other type of responders often are resource rich. In the rural community, however, sometimes they just don't enjoy that luxury. Their coroner may operate out of his or her own doctor's office, if that at all, and the police force may be quite small, and they just do not have the human resources that other areas have, and so they have to get creative and decide how they're going to take what they do have and make it work.
For more information on AWR 232, Mass Fatalities Planning and Response for Rural Communities, visit ruraltraining.org or call 1-877-855-RDPC.